Hey. Welcome, everyone. My name is Thilo Kroll. I'm the lead for the Public and Patient Involvement Ignite Network at UCD. And it's a pleasure to welcome everyone to this webinar this afternoon. This is part of the annual PPI Festival months. So there are a range of activities across the country with a focus on public and patient involvement. So this afternoon, we're particularly interested in focusing on building relationships with community partner organizations, and for the community partner organizations to have tools and the capacity to make decisions around who they want to partner with in the academic space. And to this effect, we have a very interesting and diverse panel discussion this afternoon, and we'll also introduce some of the tools that's developed on the basis of that has been done over the past few months in this space. Just a few words around public and patient involvement. It's increasingly on both the policy, practice, and research agenda, it has received a lot of traction in Ireland over the last, let's say, 5 to 10 years. So partnership building is quite essential to this effect, especially as this is likely to increase. PPI at UCD is part of a network of 7 universities and over 60 partner organizations around the country. And we've been working really to embed public and patient involvement in everything that we do around research, education, but also the administrative supports in academic settings. But as I said, today we'll focus more on, what can we do together with our partners in the community, and what tools can be used to develop relationships and build capacity in community settings. So without further delay, I would like to hand over to the PPI coordinator and manager, Dr. Emma Dorris, here at UCD, who is based at UCD Research, and who will introduce the project and then also the panel. So welcome, everyone, and I hand over to you, Emma.
Great, thanks, Thilo. I'm just going to share my screen. Just a note to any attendees who are joining, if you have any questions, please just pop them into the chat or into the Q&A box, and we have time for a discussion at the end. Okay, great. So I'm delighted to introduce this project. I'm going to take you through just very briefly how this project arose and then what we actually produced in the project. So I'm going to start with acknowledgements. Often we finish with this, but actually I think it's really important that we actually start with this, because although I'm the one here speaking to you about this, there was a huge amount of people involved in this particular project, and I want to give my huge thanks to all of them, and hopefully I will represent all the work that we did together throughout this year effectively today. So as Thilo mentioned, the PPI Ignite Network is it is just that, it's a network. So we have these 7 core university sites, and each of those university sites put up funding for the PPI Ignite Network, along with the Health Research Board and the Irish Research Council. Linked to that, we have 10 national partners. In addition to our national partners, each local office, so each of those 7 universities also has local partners. So in UCD, we have 9 local partners, and 7 of those are either charity or community organizations. And we work quite closely with them in terms of governance and direction of what we do. And through our interaction with them, a common theme that was coming up again and again was that sometimes they were struggling with the amount of requests that were coming in relation to PPI, or the quality of requests that was coming, or the expectations that were coming were perhaps not realistic from researchers. And we decided then, because we work together quite closely, that we would put a work stream together for this year on the PPI Ignite Network at UCD stream of work to actually tackle some of these issues. Now, the big problem, of course, is I have worked in academia and pretty much my entire working life. I do not work in the charity sector. So we really did need to have this to be a collaboration and to have full buy-in from our partners to actually produce anything that would be usable, because although I can administer and be in the middle of it, I don't know the realities of what it's like to work in a charitable organization where you are having researchers ask about PPI. If anybody has seen a presentation from me before, what I typically present is a slide like this. And I say my role in the PPI Ignite Network is I work on building capacity on 3 levels. I work on building capacity within our researchers, for our PPI contributors, and for the academic research culture and the research institute itself. But of course, in reality, for our researchers to work with our PPI contributors, we often go via our community and voluntary-based organizations who we often work with. So our researchers and our charities tend to have the same shared goals, we just tend to tackle them by different routes. So it makes sense that we work together on topics like public and patient involvement. The big issue, of course, was that as we really focus on public and patient involvement within the universities, and people are getting the concept more and more and really wanting to actually live this experience, those requests to link researchers with communities are growing. And although there is a degree of capacity and resourcing within the academic environment, that may not be the case within the third sector, within the charitable environment. This is a huge array of different types of charities, from small kitchen table run charities who are involved in this through to larger organizations. And there are different capacities across each of those different organizations. So we kind of felt, well, if we are true about sustainable PPI and this really being a new practice of research that we want to embed into future research as a normal practice, then we have to build sustainability not just within the academic organizations, but we also need to support our community partners within this. So we sent, working with both our local partners, we then sent out I suppose, an expression of interest to a variety of different charities and community-based organizations who have experience with PPI to come and work with us on this topic. And we started this work stream with a workshop that happened in March of this year. And we said, if we're taking this approach, the first thing we need to do is really understand the issue at hand. And we said, we're not going to look specifically at PPI as a whole. We're going to focus the lens in really specifically on this early stage of engagement. So when people are reaching out for that first time to make those connections in order to be able to build PPI. So we're looking at that very, very start. So we took the approach of that workshop to identify the issues and then prioritize them. And then after that workshop, we worked through a variety of different potential solutions for that. So when we were looking at prioritizing the issues, we looked at it across 3 different lenses. We wanted to understand how universal some of the issues that were brought up actually were and how different they were. Because as I mentioned, you know, we talk about charities, it's hugely different types of organizations within that umbrella term. We also wanted to look at how solvable issues are. Some issues are more solvable than others, and some are more solvable in the short term, medium or long term, and then how feasible they were. So if we did come up with the solution, how likely was it that somebody could actually adopt this without there being too much cost or resources needed? So when we talk about identifying the issues, we talked about what's the issues on a value-based frame, so kind of values of the organization, but also what are the technical and the operational issues from a charity's point of view. Prioritized down to 6 key issues. It's probably not surprising to a lot of people there that costing is at the very top. But other issues that were prioritized were things like the continuity of relationships. So sometimes people felt they were being used essentially like a service. Introduce us to your community and then we won't talk to you again. You know, you're no longer involved in this relationship. And they felt that that introductory, that aspect that they were doing, that they were being left behind or left out after they had made those introductions. It's also the big issue of competing priorities between their remit for service delivery, which is a lot of charities' remits, versus research, which for all charities is not the same priority. There was then the actual process of engagement, mismatched expectations, and fear of saying no. So we obviously can't solve everything, but we focused on particular streams where we could develop solutions around it. And that's what we're going to discuss and present to you today. So 3 particular strands of solutions that we came up with. One was around the, I suppose, the operability of it. So there are already some charitable organizations who have formalized, proceduralized application processes in place for when people want to approach them for PPI. So the important part is more peer learning and peer sharing within that area so that more people can learn from what they have already experienced. The next focused on both that competing priorities piece and the fear of saying no piece. And that was the development of a decision tool, which I'll go through. And then the next one was focused more on the continuity of relationships and the mismatched expectations. And that was development of what we call an expectations of engagement template. And I will explain to you what they mean in just a moment. So to note, the resources that we talk about are available as of now. They're currently on the UCD PPI website. So if you go to ucd.ie/PPI and go to plan, you will see there is now a specific link for planning for charities and community organizations, and you will find all of the resources available in that one place. And I'll send that link out after the seminar today. So the Alzheimer's Society of Ireland have a specific dementia research advisory team. As part of that, they have developed a guidelines for engagement and a guidelines for involvement of people with dementia. They have also developed an application process whereby researchers apply to be put in contact with relevant people from the DRAP team, the Dementia Research Advisory Team. So they have very kindly shared that application process with us and that guideline. The other aspect is that the Health Research Charities Ireland developed a template for their umbrella organisations. And this, again, it's a similar thing. It's a template of recommendations of things that you should ask for when people want to apply to you to be put in contact with their communities. And again, they've allowed us to share that on our websites as well. The next aspect that we developed was what's called our PPI Connect decision tool, which is essentially a very simple decision tree. And fear of saying no was really one of the big aspects that people had, and that's no surprise really. The charity industry tends to attract people who want to help, but they also, it may not be within their remit, or they may not have the capacity to always help as much as they would like. So this helps to give a clear process by which you can quickly review incoming applications from research. So this very simply has, oh, that's not meant to happen. Hang on now, I'll just stop sharing. I accidentally clicked on something and reshare again. There we go. Forgot I had embedded something into the actual decision tree there. So it goes through some very simple questions. So things like, is it of interest to your organization? Does it align with the organization's goals? And then some operational issues like, have they given an adequate time frame for review, and is it adequately resourced? And it's a very simple decision tool that makes you kind of go, yes, we'll take this one on, or no, we either need more information or we'll refer them elsewhere. We have this in both this format, but also in an editable format, because different organizations will have different aspects they want to include in this. Yeah. Being very careful not to click on it in the hopes that it, there we go. Okay, great. So the final resource that we developed is what we call our expectations of engagement template. This is a template that any individual organization can take and amend as per their needs. What we have done is we've divided into sections. Not all those sections might be of need or of interest to your organization. You can take them out and ignore them if they don't apply to you. The idea is that they're there to think through. And this is to focus on the mismatched expectations. So the idea of this is that at the very start, you clearly lay out what can reasonably be expected from your organization by a researcher, and importantly, what shouldn't be expected of your organization, but also what you then expect of that researcher should you then decide to work together. So at that very start, even before that they have actually applied through you to you to work together, they can see what is expected of them and what you can actually provide and bring to the table. So the idea is it clearly lays them out. This can be helpful from an organization's point of view, because then if they don't live up to certain aspects of that, you have something that you can refer back to and say, well, actually, you agreed to this at the start. From the researcher's point of view, it's really helpful because we don't necessarily know that the organization that we're reaching out with, we don't know how well staffed you are in this area, anything like this. So this really helps for us to understand the expectations from the researcher side of things as well. Okay, and that's just, again, to say that they are currently all available. So I've given you a very quick overview of why we did what we did and what we actually provided. In the next part of the seminar today, we're actually going to discuss with some of the people who were involved in developing these tools, and have better idea of how they could potentially be used and how they foresee them to be used in reality. Because at the end of the day, that's what we want. We want to develop things that will actually reduce the burden for community organizations so that we can all work together better in the end. So I'm just going to stop sharing there. And I'm going to invite my colleague Dylan. So Dylan Keegan is the Research Subject Advocate at the Clinical Research Centre in UCD, and Dylan is going to moderate the discussion for us. So Dylan, over to you.
Perfect, thanks Emma very much. So first, just a very warm welcome to our panellists today. So we've Sarah Delaney from Health Research Charities Ireland, Dympna Mulroy from Muscular Dystrophy Ireland, and Joanne Murphy from Family Carers Ireland. So what we might do first is just get an introduction from each of our panel members. I might go to you, Sarah, first.
Thanks a million, Dylan. Yeah, I'll be brief. Yeah, my name's Sarah Delaney. I'm the Research Support Coordinator with Health Research Charities Ireland. I come from a background years ago of social anthropology, but have worked then as a health services researcher before coming to HRCI. So HRCI is the umbrella group. We represent over 45 health research charities. So all our members are charities that have a focus on health research. My role is varied. I work with the HRB in running a joint funding scheme that brings together charities and the HRB to co-fund projects of relevance to them. And that's really important for this work, because this does mean that charities and researchers are increasingly collaborating on applications to the joint funding scheme. And that brings real opportunities, but also a few challenges as well. We're also a national partner in the PPI Ignite Network. We're co-leaders of Work Package 1, and I've worked with Emma on PPI and lab-based research and producing important teaching resources for that. And we're also involved in Work Package 2 on developing a PPI module for PhD students. I also do guidance and support for our members in PPI, and I run a PPI shared learning group that supports members on key issues in PPI. And one of the hot topics over the last year is in our PPI shared learning group is how can charities and researchers better partner together. So it's a really, really relevant piece, area of commonality between ourselves and HRCI and this group and what we did with the various tools that we're presenting today. Thanks a million.
Thanks very much, Sarah. Dympna, we might go to you next.
Hi everyone, my name is Dympna Mulroy. I'm the Research Officer for Muscular Dystrophy Ireland. My background is in occupational therapy and I've been working overseas for the past 14 years. I worked with Muscular Dystrophy New Zealand because I lived there for 12 years and I was in a variety of support and practice development roles. And then I also worked as a curator for the Motor Neuron Disease Registry and I managed Motor Neuron Disease Research Network as well. But PPI wasn't something that I'd heard of in any of my roles in New Zealand. I started working with Muscular Dystrophy Ireland in January, and it was only really when I started in this role that I first heard about PPI. Muscular Dystrophy Ireland provides support, advocacy, and information for people who've got neuromuscular conditions. We support up to about 60 rare conditions, many of which are genetic, progressive, and no cure. And we've got people who can be diagnosed from childhood and others that can be later on in life. We've got support workers throughout the country and we provide a variety of services such as counselling, home from home, peer support groups, respite and events as well for adults and young people. I like to say the research department at MDI is relatively new. For me, joining as the research officer, I've just developed our research strategy for the next 3 years and PPI is embedded throughout this document. Also, one of my things is putting in place like policies and frameworks around our processes for PPI. And that's why I was interested in building PPI relationships and the capacity issues that kind of from the workshop that we had. Supporting researchers in the PPI process, is time consuming and resource consuming, especially when you're a department of one like myself. For me, we're working on a couple of projects at the moment with PPI participants. One of these is a Building Connections program. So this is actually going to be starting up in the coming weeks, and it's where we've got 3 workshops where we'll have people from our community working alongside master's students to formulate research questions. And I've also had experience working with some researchers in UCD where we had members of our community review their survey questionnaire, their information sheets, and provided some valuable feedback that did require a change in ethics. So I guess for me, I can really see, the value of PPI and particularly like when it comes to planning activities. And I just feel, that it is really important that we nurture our relationships with the community as the charity organization. And again, the tools that we kind of will go on and has been spoken about already today, I feel like they are really, really important because they do kind of help shape the landscape of what it would be like to engage with us and what our expectations are. Because really, once the research is over, we are the community or the charity organization for our community, and we're that constant in the person's life. So it's just really important, that we can build long-term trust and partnership with our community. That's me.
And finally, Joanne.
Hi there, my name is Joanne Murphy and I'm the Research Officer with Family Carers Ireland. So Family Carers Ireland, for those of you who mightn't be familiar, it is the national charity supporting family carers in Ireland. I believe that we're supporting, I think it's there's over 500,000 family carers identified in Ireland, and family carers provide support through peer support, home care services, respite services. There's also counselling and psychotherapy, as well as social groups and outings. We have hubs all over Ireland, so it is a national service. So we would have quite a reach there. And then I suppose I'd be working the research side of things. So I would be working alongside my research manager, Dr. Nikki Dunn. And between us, we help the research function by conducting internal research. So that would include our state of caring, which happens every 2 years. There is also internal evaluations, partnering with different external researchers, facilitating recruitment for research projects. And we also do facilitate PPI recruitment for research involving family carers. And we're actually very lucky to have set up a PPI panel. So we've brought together 10 very enthusiastic family carers who have come together to help embed PPI within our research function. So we would have originally set this up in 2020 and refreshed the panel earlier this year, refreshed and expanded, thankfully. So we have family carers from across the country coming together to help develop our PPI capacity and also develop the capacity of the PPI contributors. And I suppose we're in the stages of kind of setting up our kind of documentation within that and what we want to achieve as a PPI group. And I suppose these kind of tools are definitely something that we're interested in as a group, as we partner with different researchers and also expand in our research, expand our services to different researchers as well. Yeah, I suppose that's kind of the whistle-stop tour of it. Looking forward to this.
Perfect. Thanks very much, Joanne. It's great to hear about your backgrounds, and they're so varied and very rich with PPI as well. What we might do just to kick off is just get an idea of what made you interested in being involved in this piece of work. Dympna, do you want to start?
Yeah, sure. So I guess, like I said, really, I was new to PPI and research, and with kind of research department being relatively new as well within MDI, we had no formal processes in the organization. So for me, while I was coming up to speed with what kind of PPI entailed and what it meant, I was really keen to develop processes and tools and how we could support PPI both to our stakeholders, the researchers, and then also to our community as well. And I guess I recognized early on in my first PPI activity that to support it adequately, I needed to allocate time and resources, and thus needed a system to ensure that the projects we supported were going to be impactful and meaningful for the community. So as we had no process for streamlining requests, I also didn't want to say yes to everything either. And I attended a PPI shared learning group, and from that was able to really learn from others' experiences about how relationships can break down between researchers and PPI participants. So kind of over the last 10 months, as I've been coming up to speed about PPI, I've seen I see what this is a really valuable piece when planning and conducting research. I knew it couldn't just be a tick box, and therefore the things like good communication, policies, processes needed to be in place to protect all parties and to respect the boundaries. So for me, I was really interested in this because learning from the experiences of others who had more experience in the field and understanding the importance of having good communication early on and understanding expectations of the parties and how to deal with conflict and confidentiality. I felt that it was a really good thing to be, like, I really wanted to be part of, and it really interested me so that we could build our own processes at MDI. So for me, I feel, that what we've produced will be a great resource to address these issues and to help lay out any expectations in advance of partnering with researchers.
Great, thanks, Dympna. As you mentioned, there's a lot of kind of complex things we had to work on throughout. Sarah, we might go to you next.
I'd echo what Dympna has said, bringing her experience in MDI. That's something that would be reflected across our health research charity members. And what made me interested is for the last, I'd say over the last year and a half, this issue of charities partnering with researchers has become more and more to the fore as the PPI environment has exponentially kind of expanded here, very much thanks to all the hard work done by the PPI Ignite Network. And as PPI has been highlighted at network level, but also by funders, who now require PPI in applications, the number of applications to charities from researchers expanded very quickly. And so we would have been aware that charities were experiencing difficulty And, you know, and to be fair to researchers are also, you know, finding their feet in this changing world, and that the expectations of each might not be necessarily matched. And so we definitely saw a need for improving the relationship between charities and researchers, because it's a really good, when the relationship works, it's absolutely brilliant. And it also guarantees, you know, research that is of direct relevance to patients. So it's a really positive thing. It just needs a bit of support. And so when I heard about the workshop, I thought this is definitely something we should be involved in. This is really, really relevant to our work. But also we were working with Edel Murphy, the National Programme Manager of the PPI Ignite Network, on producing a guide to charities and researchers partnering for societal benefit, which I'll talk about a bit later. But it was just that at the time that this Emma was organising the initial workshop, that's what we were working on. So I felt like this is absolutely brilliant. This is really going to be a great synergy, a great coming together of, you know, different work strands and different organisations. So we had a common interest really in supporting organisations to partner successfully with researchers. And, you know, the great thing about these tools is it's also a great support to researchers who want to partner with charities as well. It gives them signposts and guidance in, you know, so they're no longer kind of trying to start from scratch. So, yeah, that's why we were really interested.
Yeah, those are some great points. And one of the ones you touched on there was sometimes people are doing similar work. So it's kind of good to get everybody together if they have, I suppose, common goals or common interests. Joanne, do you have anything else to add to that?
I think a lot has already been covered, but I suppose, as Emma kind of mentioned earlier, that kind of increasing quantity of PPI requests is definitely something that we've become aware of as an organisation, just with that demand, as Sarah mentioned, with funders now looking for it. And I suppose that brings into question some of the quality of the requests that we receive. And it was just really looking for a way to kind of nurture really meaningful and successful partnerships, and just looking for a way to kind of streamline it and ensure that the people that are getting through to us are genuinely involved and are going to produce really insightful research. And I suppose, again, it did kind of coincide with the refreshment of our PPI panel. And it was just something that we found really important, just to have these kind of tools. Because even before the initial workshop, you're kind of questioning how do you even go about this? But it's not only when you come together with other organizations, and obviously there is differences between sort of those larger organizations and the smaller organizations, but there's actually that through line of difficulties and challenges that we all kind of share, and really getting down to it and understanding that this is something across the board that needs to be addressed, and discovering a way to address that was just something that we found very, very beneficial.
Yeah. So that brings me on to my next question. You were there talking about the kind of different sizes of charities, and there's so many of them. Given that there was such a range of charities that differed in size and with their experience in PPI, like you mentioned, how did you find the experience of working together to develop these resources? Sarah, I might go to you first with
that. Yeah, you know, it was really positive, and I'm going back to the initial workshop, which I thought was really innovative and creative workshop, and it was designed to produce concrete outcomes and a clear path for follow-up, and that's what I thought really great. I thought, you know, to actually, you know, have designed follow-up and an action and outputs into the whole workshop process and structure was a really positive way forward, and, you know, a way to actually having impact, which is another area that we're really keen on, you know, that the stuff that we do has real impact. I really liked how the ideas at the workshop were translated into really concrete actions that were kind of co-produced between Emma and the research side and the charity side, and the fact that this was followed up by Emma to make sure that we were actually going to produce something at the other end of the workshop. It's just so positive. I thought setting up a short life working group was a really effective way of developing the expectations of engagement template. And I also found that the people involved in producing the templates and the other tools, there was real commitment, there was real drive, people were very engaged. I thought the collaboration and working together across sectors was really, really positive. And it's produced, a really comprehensive set of tools that I can definitely see our members using. And that'll make a difference and support healthy partnerships between charities and researchers.
Absolutely. Joanne, I might go to you next. How did you find the whole experience?
Really echoing a lot of what Sarah's already said. It was an incredibly positive experience. It was really validating, I feel, to attend the workshop and really hear that the issues and challenges that you're facing are kind of across the board, and that you're almost not alone in the fears of saying no, or challenges with expectations of researchers and organizations, because at times you're kind of questioning, oh, is this just me? Am I being difficult? But no, just really getting down to the kind of issues that are coming up. But not only that, but coming away from that workshop knowing that there are now steps in place to address the issues that have come up, and really that focus on solution was just incredibly energizing and just incredibly pragmatic as well. I found, especially coming away from the end of this process now with these really tangible, malleable tools that we can use to impact the day-to-day operations in PPI in our research sector, that I just found it incredibly interesting. And just the way that they brought together all of the charities to kind of identify that and work on the solutions together. It's just incredibly a positive experience, and very happy with the results as well. Yeah.
Thanks, Joanne. And Dympna, anything else to add to that?
Not really, if I'm honest. I think both Sarah and Joanne have really covered it well. Just to really say that, yeah, I found it a really positive experience as well. And again, found it just really reassuring to hear that regardless of the sizes of other charities and their level of experience, there was a lot of commonality when it came to facing similar challenges around time and capacity. So yeah, I just thought it was really good to be able to work collaboratively together, and just like the girl said, that we've come away with a resource that is going to be of benefit, and just really positive experience to work on.
Thanks. So one of the key goals of the work was to try and make something that was really usable and will actually help address some of those key capacity issues that we talked about. So how do you foresee the resources that we talked about, so the terms of engagement, the decision tool, and any other learnings actually being implemented in organizations like yours? Joanne, I'll go to you first.
Yeah, I suppose I can kind of only speak on our own behalf, really, but as I said, the tools do seem very pragmatic, and we do have plans to implement all three into our PPI process as such, with working with researchers. I suppose as I mentioned, we do have our PPI panel, and they will definitely be involved in the production of that decision-making tree. I know that at the moment we recently had our kind of general ways of working initial meeting, and what kind of came out of that is we're going to remain assessing them at an ad hoc basis at the moment, but there is a plan to develop that decision-making tree in time, really personalize it to our needs and our values and our in our organization. And the terms of engagement, likewise, that is definitely something that we're going to implement. And I suppose we knew that there would have to be something in terms of engaging with the PPI contributors, but oftentimes working with the organization, that can be kind of forgotten as such. So really having those kind of terms of expectation or terms of engagement and listing out the expectations on behalf of the organization, I think that's super important. And at the moment, I'm involved in an application for PPI seed funding in UCC with a researcher, and she is working with two of our PPI contributors from our panel. And I actually hope to develop the terms of engagement kind of based on that relationship, and continue to modify and change it as the needs kind of become kind of clearer, and terms of engagement kind of become clearer as we go through this kind of very early engagement. So yeah, I'm really excited to kind of get working on this and just have something really solid there that we can refer back to, just ensuring that the partnership that we have with researchers can only be beneficial going forward.
I think you touched on a really good point there, that a lot of it is adaptable to your organization. That's something that the organization should keep in mind, that it's all adaptable, and kind of you make it work the way that you want it to work as well. Sarah, do you want to add anything to that?
I think John covered most of what I was going to say. I mean, for our approach in HRCI is basically, now that the tools have been launched, we'll be disseminating them to our members. And again, you know, just looking at, you know, the different, adding to the tools and supports we can give to our members to engage with researchers. It'll be presented at our shared learning group. And we would envisage that our members, as Joanne was saying, will treat it like a living document, that you can adapt it and adopt it when you are approached by researchers, and it's very, you can tailor it to your specific situation with the, you know, with each researcher's request. So I think that flexibility in the tools is brilliant, along with the decision tree. We already use our application form for researchers that we have put up and shared as part of the suite of tools that we're launching today. But basically, you know, it's really for us to get the word out to our members and support them in that, using the tool and adapting the tool.
Thanks, Sarah. And Dympna, any additional comments?
Probably just to say that, so like I kind of mentioned earlier, you know, we are like developing our policies and strategy around PPI, and kind of like what both Joanne and Sarah mentioned, you know, how the tools are adaptable. So even with the decision tree, and that's something that I've already kind of been adapted and have got incorporated into the PPI strategy. And as well, kind of, you know, we're in the process of setting up a PPI panel. So, you know, some of the tools around the expectations of engaging with researchers will be something that will be discussed with our group as well. And we also have a draft form of, or we've put it into action, I suppose, really now, but like a PPI application form was something that we were using prior to the workshop. So I'm planning to look at this and ensure that it aligns then with our form around our expectations of engagement. And I just feel as well, these tools will really help open up the conversation and dialogue with researchers prior to entering into a partnership, and just ensure that all parties are aware of each other's expectations and limitations before moving forward.
Exactly. So one of the benefits, we talked a lot about working collaboratively and working as a network. And you can design these resources to work cohesively with others. And Sarah, you had mentioned earlier the Charities and Researchers Partnering Guide. Do you want to speak a little bit about that?
Yeah, I'll pop the link up to it up in the chat as well. So we, with Edel Murphy of the PPI Ignite Network National Office, we have oh, thanks, Emma. We have produced a guide to charities and researchers partnering. And the guide itself focuses primarily on partnering at an organizational level with researchers. So one part of that is PPI, but it's actually kind of a bigger area of engaged research, so that because charities are not just partnering to give access to their PPI contributors, but they're also partnering as collaborators in their own right as organizations. So the guide tries to encompass the whole range of potential partnering scenarios, and looks at the expectations of charities and the expectations of researchers, and the constraints that charities operate under, and the constraints that researchers operate under. And we developed a set of recommendations for charities, for researchers, for institutions, which I think is very important, that research institutions are also brought into this relationship, because there can be issues once you get into the workings of the institution, say at finance level or whatever, and also for research funders. So we would see, so that's the guide. We would see this suite of tools that we're launching today as a really good way to combine. If you combine the tools of today with the guide, that's really an effective way to strengthen the relationship between charities and researchers overall. So we're recognizing that there's researchers and charities need to have long-standing, mutually beneficial relationships within which requests for PPI contributors can be supported using the tools that we're launching today. So we're really looking forward to seeing how the tools and the guide will be used in the future. And as I said before, to see them, both the guide and the tools, as living resources that can be adapted for the needs of each organisation. I think it's the combination of the two that's going to be very powerful.
Thanks, Sarah. Yeah, I think, like you were saying, the expectations of engagement is just something that fit nicely in with the HRCR document. So we've a final question before I move on to any of the Q&A ones. So this is around success and what success looks like in this space. So if we were looking in 3 to 5 years time, what's that one thing from the perspective of you being a PPI kind of active charitable organizations, what would you really like to see evolved or improved in that PPI landscape that would make you think that you've successfully improved PPI or advanced it in that regard? I might go to Dympna first.
Yeah, I think for me, I feel like researchers and students, that they're well supported in developing the skills to facilitate and develop PPI relationships, and ensure that that this then is incorporated early into the planning and development of their research, so it's not just seen as a tick box exercise. And also that all types of research, whether it's undergrad to clinical trials, would have PPI involved in it, and that researchers would take an interest in understanding the needs of the group that they're researching prior to planning their research. Just because I've come across that as well sometimes, where you'll get a proposal through, but they actually haven't really read up much about us as an organization, or actually the community as well. So I think that that would be really important, and recognizing the time and resources that is required when it comes to charities like ourselves, being that kind of coordinator or facilitator to partner with PPI participants and to help build those relationships. So I think having recognition for that, whether that is built into grants, that there is a financial element that just becomes kind of part of the process, rather than something that you might have to scramble for. They're kind of the key things that at this stage I see.
Yeah, that's a great point. I think it's something that's echoed for many years now, is the time and resources it takes to actually implement PPI and to do it meaningfully, and making sure that it's a valuable exercise, and like you said, not a tick box exercise. Sarah, we'll go to you next. Do you have any comments?
Yeah, I think I was kind of going, my wish list. And I realized, I'm going to have to narrow this down now because it's a big, long wish list. But I think the key thing is, at the moment, we're moving towards a situation where PPI contributors are being recognized as integral to the research life cycle. But I would like to see charities also being recognized as integral partners and just an essential element incorporated into the research life cycle. And that means long-term, mutually kind of beneficial relationships between researchers and charities and PPI contributors. Where charities are increasingly co-applicants or collaborators on grant proposals. But there's that issue that we spoke about at the workshop that kickstarted all of this, which is how do charities recover their costs for getting involved? And in that I'd love to see a situation where the institutional barriers to partnerships are removed. So not putting the onus on the research, just on the researchers, but also looking at the environment within which researchers work. And how can we make that an enabling environment for these partnerships to grow and flourish? So that would be my shortened wish list.
Yes, yeah. And Joanne, any thoughts there?
Yeah, I definitely agree with both Sarah and Dympna's points. I think that success definitely is that PPI just becomes this kind of omnipresent focus in research, and that it's not a question of if PPI is involved in the research, but how, and it just becomes kind of the norm in that sense. But I suppose kind of springboarding off what Dympna said as well, that it's not just there, but it's there and done well. So building that capacity in researchers and universities and I suppose in organizations as well, just to make sure that everybody is has that capacity and the knowledge to be able to facilitate appropriate PPI in different research projects. And I suppose that does differ from project to project, but if you're doing it well and not just doing it as a tick box exercise, I think that it can really, really improve the quality of research that's going to come out of this. So the more publicity and the more ever present it becomes, the better I feel like everybody is going to become at implementing PPI in different research projects, and really focusing on that early implementation of it. So getting involved before a research question has been put down on paper, getting involved when it's an idea. I think that's really important, and I think the benefits that could come from that are just unimaginable.
Absolutely, yeah. And I think sometimes I know we hammer home that idea of trying to get it in as early as possible, trying to involve PPI, and it can be quite difficult, but it's not something that we should be scared of. It's something we should be kind of promoting and motivating to do. And two of the things you had mentioned there, again, just around everything we're talking about here, is that capacity issue and relationships and how important they are. So that's our final question there. We have, I think, one question so far in the Q&A. So we have a question from Ella. So do you have any recommendations for introducing these resources, especially the expectations template, into ongoing collaborations with researchers? We'll start with Dympna. Maybe do you want to jump in there, or if anyone wants to jump in ahead, rather than me calling on them?
I can give it a shot.
Yeah,
sorry there.
I suppose, as I mentioned, we're in the process of working with a researcher at the moment who's implementing PPI at the very start of her research project. I suppose what kind of prompted this is the funding that is available, specific PPI funding which is available for this sort of work through the UCC partner or UCC PPI Ignite. And I suppose it's kind of easier in this scenario because the actual work itself that we'll be working on is kind of focused on PPI, and one of the kind of outputs that she's hoping to do or produce from this piece of work is kind of the experiences of the PPI contributors, the researcher and the organisation. Or one of the outputs is to kind of collate these experiences and produce some sort of guide, or it's again, I suppose, because nothing's set in stone in terms of what's actually going to happen. The actual output itself is not yet identified, but there will be some sort of output, either giving guidance on what worked or what didn't work, or how to work with family carers, and by proxy how to work with the organisation and the kind of difficulties or challenges or facilitators that come up in this journey. And I suppose the terms of engagement, that piece, I do plan on introducing that with this researcher, just because I feel like this could be a project that will kind of reflect the expectations and really bring to the forth what kind of expectations, or what are the kind of details that we should include in this document. If you're working with somebody ongoing and they have you're engaged with a researcher and providing PPI support in that sense, I feel like it probably would be beneficial to kind of get on paper these unsaid expectations that you've both been upholding or maybe not upholding, and really addressing that as well. Yeah, I think that could be a beneficial exercise, just to bring up that, oh, we're introducing this document into our organization. I'm just going to send this draft on, and do you think this reflects the relationship that we've had so far in this process? And maybe kind of getting their feedback on it and saying like, oh, I didn't understand that you had this expectation, or X, Y, Z, and just having that conversation. Obviously, it depends on the relationship or the partnership that's currently in existence, but it could be a fruitful.
Absolutely, yeah. And Emma had mentioned that in the beginning, setting out those expectations and always having that almost as a review to see where we're at and to making sure that we're each hitting our own expectations. Sarah or Dympna, do you want to come in after that?
Excuse me. Sorry. I don't have much to add to what Joanne was saying there. I think if you're introducing the template, it's good to have that a conversation, be it setting up a meeting or whatever. I think sitting down and communicating about it and liaising in partnership with the researcher, especially if it's an ongoing collaboration, because, you might have had practices that have been running, without much question, and suddenly they're going to be placed under scrutiny. So I definitely think it depends on the relationship, obviously. But it would be, I think a good idea to, if you wanted to introduce the template into ongoing collaborations, would be to sit down with the researchers and, work through the template and make sure everybody has common ground.
Yep. And Dympna, any final comments? And we might hand back to Emma then.
To be honest, I don't really. I kind of echo really what Joanne and Sarah said, just in terms of introducing it. Yeah, I think they've covered all the key points.
Thank you so much. I'll hand back to Emma. Thanks very much for our panel discussion today. It was really interesting to hear about all your experiences with the resource development.
Brilliant. Thank you so much. A huge thanks to Dylan, to Sarah, Dympna and Joanne for that. It's been a really interesting discussion. So thank you all very much, and a huge thanks to all the other organizations that have been involved with this piece of work from the start. In the event that any of you do decide to use or adapt the resources that we've talked about today, and you have any feedback on them, I mean, this is, as we've talked about, in many ways a living document, and it's been collaborative from the start, and the idea is that they won't just sit on the shelf there, that we'll continue to develop them as people use them and as we can. So we'd really love to hear back from you and from anyone that uses any of the resources today. So with that, I'm going to bring today's session to a close. A huge thanks to all the attendees for taking your lunch break with us. I will send the email after the event, which will include a link to all the resources we've talked about today. And after that, a huge thank you and a very happy National PPI Festival. Thanks a lot. Bye-bye.